Hello.
Good evening, Miss Leopold.
Good evening, love. How are you?
Good.
All is well?
Can't complain. Can't complain. Getting ready. I'm gonna open the waiting room on environmental at 6:55.
Okay.
Yes, ma'am. So I made you co-host already, so you can if anybody pops into the waiting room, you can let them in.
Okay, no problem. And if I don't want to let them in?
You give them the boot. The boot. The sneaker, the boot, the sandal, the slipper, whatever you can find.
Whatever it is, I just give it to them.
Yes, ma'am.
All right, all right, all right. Have they decided as to who will take over parks? Temporary person for parks?
I think I can go back and read Fred's email. I think he's gonna do it for now until they figure out who can do it.
Oh, I thought he said he was going to. What I read is that he was going to choose somebody, a temporary person.
Yeah, hold on. Let me read it.
I think that's what I saw.
Yeah, because somebody has to do the committee. Yeah, hold on. Where's her? Fred Baptiste. Mr. Baptiste. Hold on. You sent it last night, right? Yes.
I think so. Yeah.
Yeah, he said until a new chair is selected, I will appoint a temporary chair for the committee this month. Okay. So
Yeah.
that's next Thursday. So I guess they figure it out.
Yeah.
Yes, ma'am. Where did I put my phone? I'm sitting here with I took Madison's I have you on Madison's laptop, and I have the other laptop for WebEx. Oh, my phone is right here. It's been a long day. I have to call my dad back. He's supposed to be getting his second dose of the vaccine.
Your dad?
Yeah.
Okay.
What?
Oh, question to you though. When we have the chat and put people typing stuff in the chat, do you save the messages in the chat?
It comes. The text comes. Like when the meeting recording is done, we get a separate file. We get the video file and a text file.
So whatever was in that chat, that was typed in the chat, you have a record of that?
We get a text file.
Okay. Okay, cool.
And that's a good way to take attendance when people show up. Tell them put their name in the chat. Okay. I said that's a good way to take attendance too.
Yeah, that's what I'm going to do. I have everybody to put the names in the chat and what organization they're affiliated with.
Okay. All right. I'm heading into environmental. If you need me, text me.
Okay, will do.
Okay.
No problem. Hi, Melissa.
Hi, good evening.
Hi, good evening. How are you?
Oh, I'm good. I'm good. How are you?
Not bad. How was the day?
Good. Productive.
Wonderful. Wonderful. Good evening, Adele Flato.
Hello, how are you?
I'm good. How are you? Welcome.
Thank you. I was actually invited by Nurse Blair from Kings County Hospital.
Okay.
I think.
Okay. Can you put your name and the organization you're affiliated with in the chat for me, please?
Sure, I'll do that right now.
Yeah. And if you don't mind, and if it's possible, I always like to get the contact information just in case I have any questions.
Oh, sure. I'll put my email and phone number in there. No problem.
Thank you. Thank you. Hi, Enid.
How are you?
How are you?
I'm good. How are you?
Good. Not bad. Not bad. How are you? All is well? You had a good week?
All is well. Well, a very busy week.
Okay.
A really busy week.
Glad you are here.
Thank you, darling. Good to see you.
Same here. So what I'm asking everybody, I know the people who are on their phone, they won't be able to do it, but I'm asking each person as you come in to put in your information in the chat, your name, contact number, and the organization you're affiliated with, please, for record purposes. So as we move along, we know who attended and who we need to call if we have any questions. It saves us the time to call all over the place trying to locate people.
Okay, I just sent my information to you.
Thank you. Thank you much.
Sure.
So it's now 7:04. I'll just give people a little bit more time, a few more minutes to come in. Ms. Flato, which area of the hospital of Kings County do you work with? Or are you from Kings County Hospital?
I'm a retiree from Kings County. I used to work there.
Okay.
Public affairs.
Okay. Okay. Lucky you.
Yes and no.
I wish I could. I wish I could say that right now. I'm a retiree.
Ms. Flateau, this is Enid from Kingsbrook at One Brooklyn Health. Would you happen to know Professor Jean Flateau?
That's my brother. There's
Oh,
not
I
that
think-
many. Most
Well, then I
Flateaus
met
in
you
Brooklyn.
before. Yes,
We're all connected. Anybody
then
with
I
that
met you
last name, we're family.
absolutely. But I think I met you at Kingsbrook. At an
Yes.
event. Now I noticed your face.
I've been there many times for conferences and
Yes.
seminars. Yes.
It's good to see you.
Thank you. Same here.
So whilst we are waiting, and since Ms. Plato, you are new. My name is Francisco Leopold. I'm the chair for the Health and Social Services on the board.
Yes.
And I'm the second vice chair on the community board as well, and also the second vice chair on CABS at Kings County Hospital.
Oh, okay. Oh, you
So
on?
I guess we'll go. I'm sorry?
Oh, okay. Are you on the main cab?
Yes, yeah.
Okay, because they have, I know they have one also for the for mental health. So I was just wondering.
I'm the main one, and mental health usually join with us. We usually have meetings with them.
Oh, that's great.
Yeah, so I guess we'll go around and introduce ourselves for the others who are there. Melissa.
Hi, good evening, everyone. My name is Melissa Severe, and I'm a committee member on the Health and Safety Committee for Community Board 9. And in my day-to-day life, I actually work for the Department of Health at the Bureau of Child Care.
Wonderful. Hi, Ms. Blair. Thank you for coming. She's on the phone, so thank you for being there. Desma, we are introducing ourselves. So since you're here, and I'll go with Enid, and we'll just make it formal. So Enid will go second, and then we'll have Desma and Ms. Blair. If you are able to speak whilst you're on the phone, I would appreciate it. If not, then no hassle. Go ahead, Enid.
I am Enid Dillard. I'm the Director of Marketing and Public Affairs at Kingsbrook at One Brooklyn Health. It's great to be here.
And welcome, and thank you for being with us from last year and staying and becoming part of the family.
Thank you.
Desma? Okay, so for those persons who are coming in, as you come in, please put in your names and your contact information and the organization you're affiliated with in the chat, please. And now it's 7:08. We'll start 7:10, just 2 more minutes. 7:10, then we will start. Desma, are you there? If you're speaking, you're muted. Good night, Mr. Cummins.
Hello and good evening. I was just putting my information in. I'm Special Assistant to Councilwoman Alika Ampry Salmon. Good evening, all.
Good evening. Good to see you again.
And pleasure to be here. I'm going to be here for a while. You guys carry on 2 meetings at a time, so I'm going to stay here for a while, and then I'm going to jump to your other meeting as well. All right?
Okay. Okay, so we'll be starting in just 1 minute. And approximately what time you want to jump off?
I'm going to stay here for a half hour, and then I'm going to go to the, there's another meeting on this is social services, and then there's an environmental.
Oh, the environmental one, yeah.
Yes.
Okay, that's fine.
Thank you.
Okay, so you're welcome. You're so welcome. So tonight, Ms. Severin, she's the one who's going to lead out in the meeting, but I would like to take this opportunity to welcome each and every one of you. Hope that you're keeping safe, you and your families are keeping safe, because it's just it's not getting any better out there. It's just getting from bad to worse. So I'm just hoping that everyone, doing the necessary, taking the necessary precautions that has to be taken to stay safe and for you and your family. I'm happy that that space was given to us, that we're able to, connect with each other via this platform. We don't have to be outside and to expose ourselves too much. Ms. Severin, she will take over the meeting, and after then I have some other things that I will talk about. So Ms. Severin, when way in just before the half hour, you allow Mr. Cummings to say any reports that he wants to give before he leaves. So now I'll turn it over to Ms. Severin.
Yeah, hi again, everyone. That's me, Melissa Severe. So Mr. Cummings, if you want to go ahead and give your report from the council member's office, do you want to do that since you have to jump off?
Sure. Well, it's not very much. We continue to deliver constituent services. Our offices are officially closed, but and we're located at 400 Rockaway Avenue.
Mhm.
CB9, we only have like about 8 blocks in CB9, but I'm making my business to try to sit in all of the meetings so we're well abreast of everything that's going on in whatever piece of the district that we have. So we continue to offer constituent services. People can come into our offices via an appointment. We are practicing social distancing and all COVID protocols in our office. Anyone can stop by our office if they don't have PPE. We have hand sanitizers, we have masks, we have gloves, and we try to disseminate as much to the public as possible. That's pretty much it. I'm here for information, and if anybody has any questions, please, by all means, I'm here. Thank you.
Thank you. Yeah, no, I didn't realize it was only like about 8 blocks that you have of our area, but thank you so much for coming anyway.
Always plenty of information here though, so it doesn't
Yeah,
matter where it's coming from. It's good information. It can be used. So thank you for having me.
always. So the first thing we have on our agenda is the COVID updates. And actually I wanted to highlight what's been happening at Kingsbrook with the walk-in vaccinations. I don't know, Enid, if you wanted to talk a little bit about that or give us an update.
I definitely could. So when we get notification for the vaccine, which is of course in huge demand, we contact CB9 and then CB17 first before we do anything so that you guys know and can distribute the information. These vaccines go very quickly. And so we started, and our intention was to do 3 days. We started on the 3rd and we were going to the 5th, walk in from 7 to 6. As of today at 12:30, we had to stop it. We ran out of first doses by 12:30. In other words, we saw where our line was wrapping, which is on the circumference of our facility, and knew that if we continued aggregating people, they would never get in to get the vaccine.
Wow, that's amazing.
Right. So as of now, what we are doing for tomorrow are those who are scheduled for second doses. However, we know we have a second shipment coming in a first dose. So again, it's like you do have to move pretty swiftly. The appointment making, we tried it. We tried to see if we can just, get persons into certain blocks. It's not as easy to do. It's a bit more laborious, and it's not so easy for the elderly to do that for themselves. It's so much easier to accommodate the walk-in. And so, yes, what ended up being a 3-day ended up being a 1.5-day effort. And tomorrow is the second dose. However, second doses will continue in perpetuity. So we know whoever is scheduled, we have their dose ready for them. So we're thinking for the next 7 days, we're just going to be doing second doses.
And do you have any plans to do these walk-ins, at another time?
Definitely.
Or, okay.
Definitely. As soon as we get our second doses, I know that our pharmacy department has actually put in for that. As soon as we get it, you guys will get the notice of the additional walk-in times.
Yeah, because actually, you're the first organization that I know of that was advertising walk-in hours. Everybody else, you have to make an appointment. And like you said, it's a little bit difficult for our seniors to navigate that website. And up until I think last night, there wasn't anything available on there. So the walk-ins make a lot more sense. And I'm glad that you guys are doing that.
Yeah.
We've been having a lot of equity conversations around this at work itself as well, trying to make sure that the people that are in the neighborhood are getting the vaccines first.
Absolutely. And that's why for me, it's so integral to call the community boards first and make sure they know, and our community partners, so they can gather their seniors together, gather their eligible persons, and move them out as quickly as possible. So I really do encourage that. And I don't only just speak to send out the notice, I call and I make sure that I speak with people so that they understand exactly what they have to bring with them, what they need, so they're not turned away.
Right. Excellent. I don't know if this has been.
If I may interject, I will be sending a link for next week at 6 p.m. Dr. Katz from the Health and Hospital, he will be hosting a question and answer forum at 6. I will send out the Zoom invite so everyone could have it, and then you could invite people in the community. So he'll be answering questions. And then also, because he's the one who's really in charge of the turnovers of the vaccine at the Department of Health. And then also we're looking to, with my One Crown Heights, it's a community with the Jewish community and different people from different the organization in the community that we have come together. So we have different committees, subcommittees on that committee. And so I brought that up because what happened is that we have so many seniors, especially some of our senior centers are closed, and a lot of those seniors, they are home and they are not able to go outside. And something I saw in New Jersey yesterday that was very interesting to me is that on the news that they were taking the vaccines to the apartment buildings so that the seniors, they would just go downstairs, and also they were taking the vaccine to the centers, to the senior centers. So the seniors, they didn't have to travel too far, So that, I think that is a good thing that we could also look into. But Dr. Katz would also be looking into how best we can serve the seniors in the community. So after the meeting next week Tuesday, then we'll really, have a little bit more dialogue and get some more information as to how we could mobilize because the 71st precinct, they are willing to work with the board and different organizations, and they're transporting seniors to whichever location they have to go to, and escort them, pick them up from the center to wherever they are, take them to the location, and escort them back into the vehicle. The seniors don't have to stand up on long lines or anything, and take them back to their residential place. So that is something we could look into also. So if for any reason, and I'm happy that you're doing the walk-in, because a lot of our seniors, they don't know how to go online to get on the website to do, registering and all that. They can't do it, and they do need the vaccine.
Yeah.
So I'm happy that your organization, the hospital, is doing that also. So based on what the outcome of the meeting with Dr. Katz next week, then we can move from there. But my main concern is really get to the seniors, and because we have a lot of seniors who have chronic underlying pre-existing conditions that they really need, they are afraid to go outside. They're not leaving their homes at all, So what I'm trying to do now is to contact the senior centers that is within our district. And so I'm trying to reach the directors, because since COVID, some of the centers are closed. Some of them are in the housing, like Christopher Bledman is a NYCHA building, so a lot of the seniors, they're located there. But some of the other seniors, they're at home. And then Department of Aging, they are the one now who has full control over the day-in daily activities of the seniors. So I want to get in touch with them as to how we can reach out to those seniors, because seniors already know them. So they already have all the information, so in the database, so therefore they can call them and find out from them if they, because truth be told, some people we are really fighting for that, but there are still people who don't want to take the vaccine, you know? So then we still have to find out as to who is interested, you know, to take the vaccine. So we'll know which building, as to how many people, the addresses and everything, and then we'll take it from there and move ahead with it. Thank you so much, Melissa.
Yeah, no, thank you for that. And you said that that meeting is happening on Tuesday with the One Crown Heights
The
and Health
9th.
Hospitals. Okay,
Yeah.
and you'll report that back for the next meeting. Okay.
Yeah.
If there was nothing else as far as COVID updates, we can move on to the next thing on the agenda, which was the Community Health Forum that we had started talking about last month. So we wanted to focus on mental health and maybe one other related issue. I don't know if we still wanted to tie it into COVID or it was more of a standalone mental health type of forum, but obviously with everything that's been going on with the pandemic, people are way more stressed out than usual. So that has to be a part of the conversation some way, somehow. If it's not central, it has to be a part of the conversation. I would definitely be happy to talk to the mental health ERG at my job to see if they would want to come and maybe present something. But if there were other ideas as far as how we want to present it, it doesn't have to be, I don't want it to be a lecture style, you know, people are kind of over it, you know, with all the Zooms and getting lectured to. So I'm open to other ways that we can have dialogue about mental health during COVID.
Just before I mentioned, for those of you who are just coming in, good evening, it's good to see you. Please put your names and your information and the organization you're affiliated with in the chat, please. Thank you so much. So I didn't get a chance to call you, but the, Kings County contacted me today. And I was overwhelmed. I said, you know what, we were talking about this thing for the health forum. And then they contacted me. So they have outlined a few topics on the month that they really want to do this thing, and they would like to partner with us to work with us with that. So on your side, whatever that information you want to bring in, and with Kings County, we could collaborate. So for February, and we're in February already, and I don't think they will really get to do it, but they're looking to do racial equity in healthcare for February. And in March, they're looking to do oral health and COVID-19. In April, they would like to do total joint replacement. May, which is down our alley, coping with mental health during COVID-19. This is one of the hot topics for us. Then in June, we are looking at men's health, prostate. July, obesity and COVID-19, which was one of the topics that we wanted to undertake as well.
And
in August.
I'm sorry, I didn't quite hear. What did you say was for April? What was the topic for April?
April, total joint replacement. Total joint replacement. And May is coping with mental health during COVID-19. June, men's health and prostate. Then July, obesity and COVID-19. And then we have August, which is family planning and breastfeeding. Then September, sickle cell. October, breast cancer. November, diabetes. And December, ambulatory care services and flu vaccine and HIV. So this is for the whole year, and then they would like to work with us. So anything else? And what I would really like to ask the committee, those of you who are here right now, you are here, and I know some persons are coming for the first time, and I would love to see that you come back and work together with us. And as we plan, they may have other areas that you would like us to do something. You may have other ideas, and we are working. It's not a Francisco Bernard, Francisco Leopold thing or CB9 thing. It's a community thing, and we are here to work together for the betterment of the community. And I would like to hear your ideas. I would like you to come back and say, hey guys, let's do this, or send me an email or give me a call and say, I would really like to see us, not you, but I would like us to undertake this and do this for the community. Be it I want to do something for homeless. We have the youth, we have the shelters. There are so many other areas in the community that we have to do work. We don't have the manpower, but if we start, we just have to light the fire and it will catch. Somebody have to start it somewhere. So please come with your ideas. Even we may have an agenda set when we have our meetings, but even when you come with ideas and things you think that we can do for our community to make things better for the community. So these are what I have to say based on what we want to undertake for the year. So for February, since the young lady from Kings County, she'll be getting back to me because we had dialogue today based on the racial equity, and racial equity in healthcare, that has been a big thing out there. So we really want to touch on that. So most likely we have to get the flyers together and get everything together. So most likely we are looking to do it if they do give her, for me on my side, it's a go. But if they do give her the green light, maybe the last week of February, and if not the last week of February, then it will be the first week of March.
That sounds good to me. Since they have all of these different themes for those months, and we want to partner with them, then we should just plan to me, it seems like simple that we should just plan our year around those different themes. The only thing is if they change things, and then we'll have to do our own thing. But yeah, I'm happy to pull whatever resources I can get on my side for racial equity. Dr. Mayendo that came that last time, that's his area of expertise as well, racial equity. The one that spoke to us, I think it was 2 months ago now, from Department of Health.
Yeah.
Right. So I'm not as familiar with the other committee members. I see Sabrina, Karima, and Desma. I've heard these names, not to put you on the spot at all, but if you have any ideas or thoughts as far as the Community Mental Health Forum, please feel free to put it in the chat, and so we can.
And if we can see your faces, it would be nice to see your face too.
Oh, okay, I remember you, Sabrina. Yeah. We did meet. Yes, because you were working on sickle cell, which I think they said for Kings County, that's going to be. Francesca, I'm not remembering which month you said, but you said there was
in September. September. Yeah.
Sickle cell awareness for September. So I don't know, Sabrina, if you have anything that's already coming up or planned with your organization that maybe we could partner with you or.
Happy New Evening, everyone. Thank you, Melissa. How are you all doing tonight?
Welcome.
It's so good to see y'all beautiful faces. Unfortunately, y'all will not be seeing my face in person tonight. But I am happy to be here though. So I will say that we've expanded. We have a sickle cell support group that started out at Kings County Hospital. And I'm happy to say that, we're under the umbrella of SCDAA, which is the National Association of America for Sickle Cell. And now we're global. We partner with Queens Hospital. And so we've expanded our outreach in sickle cell, hematology, and cancer. And so we are circulating that flyer around for anyone who has sickle cell disease and trait. I have trait. We're going to be doing a lot of education around trait, because folks who are unaware educationally of how to get sickle cell don't know that if you have trait, you may have a child or children with sickle cell. And so we just want to make sure that we do more education. Of course, we're including COVID in everything that we do. And so our last support group in January, I believe was the 26th, we had Dr. Mutu, who is one of our partners at Kings County Hospital, to, just educate on the vaccinations and COVID. You can pretty much get that education, I want to say everywhere right now. So I don't want to wear people out with that, because we still have to deal with mental health, which is really huge. So with sickle cell, we've also partnered right now with NAMI. And so we developed peer support groups, and NAMI is working with us on the mental health aspect, right? Because that's not my specialty. I can only offer suggestions. And so, you know, we're supporting our seniors and our peers, you know, our youth that are in transition. We're working closely with, well, soon One Brooklyn Health, right? And the pediatrics, yay, Enid, hugs and kisses, Enid. We're gonna be working with Brookdale Methodist, Interfaith. And I'm not, Enid, I have to get with you as far as Kingsbrook, because I'm not sure if Kingsbrook Hematology has sickle cell.
We usually don't. We don't. That's
Okay.
not a specialty of ours, but we can find another way to link up.
Awesome, absolutely.
I actually follow up at the sickle cell clinic at Kings County Hospital for adults. I actually have the sickle cell disease, so I don't know if I.
Melissa, hello.
If you would.
You need to call me directly. We have to get you connected, and you would definitely be like, you can, you know, join the committee and be an admin. Hello. That'd be wonderful.
Absolutely.
Yes,
Yeah.
that'd be great. It's not my support group, it's our support group, and my goal is for you all to take over and run with it and really grow and expand. You know, like when I show up places, I have to trade, and they're like, well, you don't know what I'm going through. And so, Melissa, I can have you show up as well as I think Sarai is here. I've invited the group to come in because we're focused on Kings County. And so I want the group to be connected, you know, to the community board and to work, you know, within the community. And so that's what we have going on. That was my long explanation, right? But that's what we have going on right now for sickle cell. Oh, besides that, we have a really huge event coming up for Juneteenth that we've been marketing. It's a partnership with Synergy. It's Shine the Light on Sickle Cell. We're asking organizations, churches, faith-based organizations, really anybody, everybody we know, to participate with us to, I don't know, start a campaign or wear red. We want to make sure that we definitely just shine light on sickle cell. I can provide information for anyone who wants the details in an email. Thank you so much, everyone.
Thank you, Sabrina. Thank you.
You're welcome.
Thank you.
So I can learn more about this support group.
Yes, please.
All right. I don't know if Ms. Blair or Ms. Bledsoe, if you wanted to chime in on any of those things that Sabrina and myself and Francesca already mentioned, as far as different events, outreach events that we would like to do in Community Board 9. Okay.
Well, actually, I'm somewhat familiar with the sickle cell clinic at Kings County because I was involved with the dedication ceremony several years back, you know, with that clinic. I don't know if you know Dr. Cromwell, Dr. Chandra.
Yes.
Yeah, I was working with her on a number of things back in the day. It's a few years going back, but definitely anything you're doing in that area. My organization, which I'm a retiree now from Kings County, but I'm the president of the National Association of University Women in Brooklyn, the Brooklyn branch, and Alice Blair and I, we're the co-chairs of the health committee for that group. So if you're doing something, we'd be happy to partner with you, you know, for any of those events. We were actually interested in, because March is Nutrition Month, we were actually looking to partner with somebody around an event dealing with nutrition and, you know, tying it in with COVID and also heart disease, because you know, we feel that those are some issues that we really need to address in our community. But, you know, the schedule that you talked about is, sounds great. I mean, all the topics sound very interesting, and we'll be happy to work with you guys to promote them.
Yeah, that sounds excellent. I'm glad you mentioned about the nutrition, because there was another thing that was added to my agenda just after the agendas went out. We want to do a healthy cooking night via Zoom. Yeah. Yes. Yep. Yes.
That's exactly what we were thinking of.
Yes, and Enid, I believe maybe you may know a little bit more about this as well.
Yeah, absolutely. So we do healthy cooking segments at Kingsbrook for Facebook Live. Right. And we do it all the time with our diabetes educator, on one hand, and my assistant, Tahisha Salagis, who's a chef.
Oh,
She's
good.
been on ABC The Chew. She's a fantastic cook, and she's a fantastic chef and very creative. And she's been doing a lot of that for education for our community on Facebook. So I think that we can encapsulate that on a virtual cooking night. And really talk about and encapsulate the obesity, the diabetes, the cholesterol, the hypertension, all of that into one, while making it fun and interactive.
Yeah, I think that would be great. My only request, if I could put it in there, was, can it be a Caribbean dish, maybe in particular?
It can be, because she's from Haiti. And so
excellent. Okay, cool.
Yeah, so it can definitely be like that. So I'll tell her and talk about it. And once we expand it, then bring back some elements of what that will be for you guys to kind of say yay or nay to.
Okay, yeah. So what do you need from us, like right now? Do you need a date or?
Yeah, I think
be on
a date would be really good. You know, a few dates that would work. Okay. And then let me work backwards. I know that Tahisha, and then let's talk about what we want to encapsulate, because you can take over an entire evening doing a meal, you know, talking about the elements of the meal. So, right. And so do we want to do that, or do we want to combine it with some type of chronic disease reference as well? Right. So I think that that's what really needs to be decided. How do you want to structure it?
Yeah.
If you do it as a series, maybe it's one night it's the cooking, then it's another night it's the discussion. I think you just have to consider how you want to frame it.
Right. And I think, Adele, Ms. Leto, you mentioned heart disease in particular. So like, even if the dish had something, you know, like beets or something, I think beets are supposed to be good for heart disease.
Yes,
like that, like incorporating it into the ingredients that are going into the menu.
Right. And also to consider, not to cut you, Melissa, but to consider opening persons' perspectives, especially in the Caribbean population, about some options for vegan eating. Yeah. And so I was a vegan for so long at this point. I was vegan when it wasn't fashionable, but I think there's an idea that if you must deplete everything. And I don't think that's the way to go. I think it's to start to introduce people to a different kind of lifestyle and introduce persons to different types of foods that might trigger an understanding that that's not as hard as I thought, because diet controls everything. It controls diabetes, it controls obesity, it controls hypertension. You know, the diet is really the cusp of disease. Right. So if we can get persons to change their mind on something, so consider that. Maybe down the road, it can be a vegan night, or let's make this peas and rice in a healthy way, maybe without the pig foot, you know, and maybe with, why you laughing, Leopold? You like that pig foot?
I don't eat pig, so I'm all right.
That's like the one, you know, that's the one Caribbean dish that I've not tried yet, and I'm just like, I'm a little bit nervous, but that's so funny.
Yeah. But we can do all, we can be very creative with how you approach this. It just depends when you want to start. And Tahisha's very creative with food and how she presents it. So we're very open to working with you guys to tailor it however you'd like it to be.
The easiest as far as timeline wise is if we wanted to do it during this, you know, standing meeting that we always have each month. That's the easiest thing to do, because it's already.
I would agree with you. I would agree with you, because I think the timing is right. It's evening, persons are relaxed, they're not thinking about work, you know. Yeah, I mean, it could have actually been an interactive thing where people act, and you know, we'd consider that later down the road, because we have done cooking classes at Kingsbrook where we have people just come together and make anything from a healthy dip where you have your fresh plantain chips, and how do I make a great hummus on my own that has low salt, you know, not processed. We've done those types of things too. Easy.
Okay, I think that we have something there. And I guess we can offline, we can work out the details a little bit more, and Francesca and I can email you some dates.
Yeah, that's good.
Pull in whoever else.
I'm excited.
Whoever else on the committee would like to participate. I love it.
Yeah. And we have I think everybody on the committee right now, because as long as you attend this meeting and you're sitting and you're having a conversation with us, I enroll you as family. You know, you are not anybody. You are family. We are here together. Sarai, thank you
always
so much
did
for
say
coming.
that, friend.
Yep, we are family. We come together. We work together. We are family. We are not strangers anymore. Just
Right.
put in, and for those of you who are coming in, just put in your names, your contact information, and the organization you're affiliated with. And I am excited. I can't wait, for that cooking, and it's going to be a series. I'm telling you, I'm a Caribbean girl. I like to eat. I like to eat, so anything, and I love to cook. So anything to stand in front of this stove is good. If you don't mind, Melissa, I would just like to invite Ms. Blair, that she would she'll talk on something that is very dear. I know it's very dear to Sabrina's heart as well. Ms. Blair, the floor is yours.
Hi, good night, everyone. Can you hear me?
Yes.
Yes, we can hear you.
Okay. Sorry, I don't want to get on the video. I'm coming in from work. I'm trying to untangle a lot in my house. But something that my role in the community, I work at Kings County. I am the coordinator for the Elton Hospital for the crisis program. So it's somewhat of a very sad note to a lot of people, but I deal primarily with victims of domestic violence, sexual assault, and a lot of children now that we're seeing in the trafficking arena. So I just want to know, like with this base, is there a way for us to get the information out to the community? I can introduce you guys to the DA's office, Safe Horizon, that will do presentations. January that just passed was trafficking month, sex trafficking, labor trafficking. And last week we did a great conference with the DA's task force and the different subjects of trafficking. And so it's just I find this to be a great base for the community that I serve. If we could get something in one of the meetings or some way as a platform, because since COVID has hit, it has been a real increase in the younger population. I'm talking about the teens between 14 to 18 that we have had really a high number of coming in with all trafficking signs, and trafficking falls underneath the same arena as domestic violence. Unless they want to accept their help, we can't give it to them. And I think we really need to educate the community, because a lot of people does not understand that these young girls, predominantly young girls, once they get in the life, it's almost impossible to get them out. And I think for us to educate you guys and everyone, so you can take the message out, this is like teach one to, to get it out in the community. We can't do it alone. And so that's my ask from this whole help committee, to see where we can go to help in that arena. I know it's not something that a lot of people want to get on their platform sometimes, because it's a sudden note, but it is a really big hack in the community that we're dealing with, because the primary population that we're serving is our African American and Hispanics that we're seeing coming through the doors days after days with trafficking.
Miss Blair, I had a question. How are these young women finding you in your services?
Because a lot of them are in the foster care, they're runaways, trafficking, the traffickers or pimps and whatever name you call them, they know how to pick their children, So even young women, they pick the most vulnerable population. So they'll come in through the ER, as some of them are coming in under arrest because they have PINs warrant out. Some are coming in because they've been missing for weeks. And then they're found by, let's say a relative discovered where they are. So once they come in, because of the sexual assault component, many times their parents want us to do forensic evidence, but again, it falls back if they, I'll go into details on one-on-one. Anyone has questions, what the ramifications around what we do. But I myself was a member of the Brooklyn Task Force for Trafficking since it opened up in 2010, I believe. So being privy to that and being the only healthcare person in that task force and sitting with the FBI and everyone, I have that inside connect. And when I've been teaching and giving all these pointers, what to look for. And so many times the providers will call me and say, I think I am identifying a victim. And then I'll reach out to the DA's office. Or just this past week here, we had a victim that came in that identified that she was assaulted by the person who she ended up hitting, and she was arrested. So, and we ended up really caring for her, doing forensic evidence and stuff. So it's a crossing over, just the fact that most of them are the younger population.
Okay.
Yeah.
We the community board also has a youth committee, and I'm wondering if when we do have that forum, because we definitely should have that forum, we should partner with the youth committee on that, since it's a health and safety issue, but it also primarily seems to affect youth. I don't know, Francisco, what you think about that, or if you have any thoughts on that.
So thinking of the youth, I'm happy that you brought that up because I didn't really think of it, but I do think that it's a great idea. And listening to the different topics that's really coming out. And I'm just gonna take in the on my own and say, with the cooking segments that we'll be hosting, I would like Enid for you to spearhead it, and we as a committee will follow up and do everything that we can do. And Ms. Blair, since I would really like you, because I know that we have spoken before, and then you're very interested in working with us and bringing everything you have to the table, and so that we could educate the community. So for this one, and I know Sabrina, she have been talking about this for the longest while, and I think that she would be a very good partner with you. And so I would like the two of you to spearhead that also. And then we as a committee will whatever that we need to do to push it, come up with dates, time, as anything else. We don't need to get a venue. We have the board's website, the Zoom. We have this platform that we can use, but whatever else that we can do to make this happen. And I am happy to host it, to put it out there in the community. And Melissa, I think it's a great thing that at any given time when we meet to discuss as to when to implement, we should bring in the chair for the youth on board. That is a great thing, great idea.
Okay, yeah, they're working right now, I guess, on their resume building workshop for the youth, but I can reach out to Primo about it and let him know. Ms. Blair, was there anything in particular that you need from us as the community board, like right now, like to get you started, or is it just getting the conversation started?
Sorry, hello, can you hear me?
Yeah, I can hear you.
Oh, no, yeah. I was muted and I didn't realize I was talking. No, I was saying, I just want the platform out. I need the community to know what services are available at Kings County through this program. Because when I first met Francesca, she, and I explained to her what we did and how we have been a part. We are a center of excellence since 2005 we opened up. A lot of the community does not even know the center is there, because if you're not a victim, you don't know that we're there offering these services and to the community, and it's under the Federal Reimbursement Act. It's free, for a victim who have been assaulted. So there's a lot that I want to use the platform to assist us in getting it out. Right now, I think it's just, if whoever work with me to get, as I said, I have access to Safe Horizon, the DA's office, who are willing to do Zoom training with you guys. They'll be the ones speaking to inform you of all the resources that is available, and anybody can help, because if like one of the biggest drawback that we have is getting housing for a lot of these children. Like once they're there, you don't have anywhere to put them, because most of the housings are not available for these victims. because they're full, you know. So those are the options that if anyone has connections in the community, or, you know, someone always knows something that is out there sometime, resources. So.
Okay. Thank
And,
you so much. If you don't mind, thank you, if you don't mind, Melissa, I would just can you find out from Miss Santiago if is there anything she would like to say?
I think she.
Yeah. Hello, everyone. My name is Sarai Santiago. I'm usually from the Bronx. And also, I work with Sabrina J. Lewis with the Kings County Sickle Cell Support Group. So I work with SCTP and also Sickle Cell Thalassemia Patients Network as an outreach worker and community health worker. And also, I work with transition teens ages from 12 all the way to 26 in the Bronx. So basically, I'm invited by Sabrina, so thank you for the invitation. And I would like to do a sickle cell presentation one of these days, if Ms. Francesca or any of the boards could let me.
What's your turnaround
Educate.
time?
Oof, let me tell you, I'm all over the clock. So I don't know what times you guys got. Or
So,
days.
well, we have a standing meeting every, I guess it's like every first or second Thursday of the month. So our next, our standing meeting would be the first week of March. Would that be enough time for you?
Yeah, I have the slides prepared because I did it with, also we out in the 5 boroughs, educating the community, and now we're expanding. This is the new news. We're expanding the bilingual support, bilingual folks for next week.
Okay.
So we're expanding the support group for the bilinguals, and we will have an interpreter to speak Spanish for the people that have sickle cell, so we can know that they're not alone, and we want to help them. Because I understand in the Hispanic community, they be like, oh, it's taboo. We cannot talk about sickle cell. Oh, we cannot explain it to our families about that. It's taboo. Because I grew up like that too. And I said, no, we got to break the chain. We got to break the chain of the taboo. So we're expanding the bilingual starting February 9th is at 12 o'clock. So Sabrina will send in the Zoom code, and definitely everyone's invited.
So that event that you're talking about with the Zoom code, I'm sorry, that's that's the support group, or that's something different?
Support group.
Okay, so
Yes,
there's
now
one line for English speakers and then one Zoom line for Spanish speakers, or it's combined?
It's, combined.
Okay, all right. So is it okay if I put you on the agenda for next month's meeting to give like a little presentation about what you're doing?
What day is it? March what?
Hold on.
So it's the first, we usually meet the first Thursday of every month at
March
7,
4th.
but
Let's see. Let me see what I have.
4th then. That's the first Thursday of the month for next month.
Yeah, I will definitely will do it. March 4th, I have nothing.
March 4th. Okay.
So what happened is that, Sarai, is that this committee, so we meet and we discuss, and if anyone come and they want to do a presentation, they would come to us and they will discuss it. And then I will take it to the executive when we have the executive. So and if we do want that person now to present at the general board meeting, then I'll present it to the executive committee, and they will make it part of the agenda, right? My problem with that is the time slot, because the agenda is so packed that the time is allotted, it is so limited. It's like you can only get like 10 minutes, to do a presentation. So you really have to capture the main points, the main focus for the people to give them the message. So that is one issue that I have with that, because it's a pack. But we have on the topics for each month, and sickle cell is coming up in September.
So maybe you could put us in September. Maybe you could put us in September.
So we'll be partnering with Kings County to do sickle cell in September. So then we'll have the time. You can work together, and we have the panel together, because what I will do, this platform for my meeting that I'm using, the first Thursday, that's when we'll do the presentation for the wider public, because if you come next, I mean, you can come and talk about what you're doing, be part of the community, be part of the planning, you know, so we'll be here. But what I'm saying, if you have to do a presentation, it will just be us. It wouldn't be the wider community. You understand what I'm saying?
Yeah.
So you could come and present and show us what you're doing and everything, so we have a better understanding, and then we move on from there. So when we're planning, because I don't like to wait last minute to do things, so we know and have an idea as to, hey, this is what we're doing.
Yeah.
So when I meet with Kings County for September to do the presentation, then I can invite you so you could sit at the table, so we can, you know, we can put everything together.
Okay. Yeah, September would be great.
Okay.
So I'm sorry, I'm looking at the time, it's 7:56. I'm so sorry, guys. I don't know if there was anything that anybody else wanted to like put out there as far as open discussion, because we only have about 4 minutes left. I'm so sorry. Was there anything else?
Really
Good
brief.
conversation. Good conversation.
This is an
Good
excellent
discussion. Good
conversation.
night, Warren.
Hi, Francesca.
I'm sorry,
How are
Sabrina.
you?
Go ahead.
Hi,
I'm
everyone.
fine. I'm fine.
Just a quick question. This is Adele again.
Yeah.
So
Yep.
in between now and the next meeting, will we have some communication by email regarding the Nutrition Month activity?
Yes. So I can start an email thread with a few dates. So it would be yourself and Enid and Francesca, and start that email chain so we can pick some dates.
Okay.
And pick the theme and then how we want to structure those particular events.
Okay, that sounds good. Thank
Yeah,
you.
I think I saw you put your email in the chat already, right?
Yes, I did. My email and my phone is there.
Yeah. Okay.
Yeah,
Right.
Nutrition
Sabrina
Month. That sounds
wanted
like
to
a
say
good.
something. I'm
Yeah,
sorry,
thank
Karima.
you.
Go ahead.
Thank you. I just wanted to say to Miss Breyer, to Miss Alice Breyer. Is she
Blair.
still
Blair.
there? Blair, yeah, sorry about that. I definitely would like to speak with you more on the human trafficking. NAACP, we hosted our first human trafficking event last year, January, and our second was scheduled for January, this past January, but due to elections with NAACP, we had to postpone it. And the date that we're looking at is March 29th. I have Stephanie Clemente, who's no longer with Safe Horizons, but we do have a team working with us with Restore NYC and DA's office. So I definitely would like to speak with you more, because we want to focus more on the children, because they're being left out. And so we definitely would like to have that conversation with you.
Okay, so I guess, Francesca, we are all in the email, right?
Yeah, I'm
Yes,
saving
so,
everyone's email right now.
Right. So everyone who have not placed their email in the chat, please place your email in the chat. So everyone will be in the email and whatever that's been sent out. So everybody will have an idea as to what's happening. Before we close, our first vice chair from the board, he is there, and he's also the chair for the CABs at Kings County. So I'd just like him to say a few words before we leave.
Hi, everybody. I'm Warren Burke. I'll focus on Kings County with Francesca, who's our first vice chair there, and Carmen Martinez from the board. A lot has been going on down there. Number one, the vaccinations. They just received another shipment of vaccine. So they're going full tilt. They have been making up the appointments that were canceled to two reasons. Number one, when they ran out of vaccine, and number two, the snow. So they're moving. I know that I was down at Kings County yesterday morning with Carmen Martinez, and we brought down 50 seniors from a senior home, and the system worked really well. The other things that are going on is that the level of COVID patients within the hospital is compared to the first surge, I would say medium. They have increased their the awards for COVID patients. We divide them into hot and cold zones. The hot zones are people with COVID. And that also applies to the R building, which is behavioral health. There's been awards set up there. They've been cross-training. They close certain services, meaning that they haven't closed them. It's still operating, but they have reduced the staff there and have cross-trained them for COVID. So, things are going there. We're just really hoping that everyone gets vaccinated, and as important, to continue wearing your mask and distancing. Are there any specific questions you'd like to ask me, anybody?
I have a question.
Sure.
Where I work in the DOE situation room in Lower Manhattan, I've gotten a lot of phone calls from principals and assistant principals, including there was one situation that a principal asked me that we're still getting the policy verdict from my higher ups, but I wanted to know, when someone gets vaccinated and they start later on from the first shot, after a little bit later on, when they start having symptoms such as fever, chills, whatever, there, is it just a side effect of taking the first dose of the vaccine, or is it COVID related?
Okay, I am not a clinician. I'm a layman, but from my understanding, and I have had the vaccine shot, that normally the symptoms that are associated with getting the vaccine are from, your body fighting back about whatever's in that vaccine, as well as inflammation around the injection site. But what I would do is continue to be tested. I have not heard a lot about this in terms of people with very severe reactions to the first shot. What I did learn is that the second shot, there are likely to be more severe reactions. And usually that's inflammation around the injection site, symptoms of a cold or flu-like, etc. What I suggest there is that anybody who's having a severe reaction, go down and be tested. And if it's a very severe reaction, go to the emergency rooms. But
Okay.
I've not heard a lot about that. In fact, it's been quite the opposite. But I'm only focused on our district here. So, but that would be my recommendation.
Okay.
And also the doctor, we had several doctors who came and who spoke to us, and I think last week was one, and Dr. Quayle, and one of the things, everybody, you're different, everybody's bodies are different. And then I might take the vaccine and I might have a reaction, and then somebody else here will take the vaccine and they wouldn't have no reaction at all. It's just like this flu shot. Some people say, me, I ain't taking the flu shot because I took it the first time and I was severely sick. And there are people who feels nothing. So it's based on the individual. So if someone do take the vaccine and then they have some sort of reaction, and as Warren says, the first thing, contact your doctor and let them know what's happening, and they'll be able to tell you, what it is a reaction that you have. And that's the first thing you should do, is to contact your doctor and let them know you took the vaccine and then this is the reaction you're having, and then they will guide you as to what you should do.
Right.
Okay, so can you wrap up?
One thing, Francesca, I just want to piggyback on that. The vaccines do not give you COVID, as far as we're being told. So I just wanted to, because that was part of the question.
Yeah.
Thank you.
Thank you so much. We're about to wrap up now because
yeah, it's 8:04. I want to be respectful of everybody's time. Thank you all so much. It was a good conversation. A lot of exciting things are going to be happening in the next couple of months with CB9. So thank you for that. I'll see you at the next one. Good night.
Good night.
So we thank you so much for coming. It is very
Good night, everybody.
exciting.
Thank you.
And I'm looking forward to the work that we will be doing together, and hoping to see you. But in between, before next month, we'll have our dialogue via email. So have a great night. Have a wonderful weekend and stay safe, everyone. Thanks for
You
coming.
too.
Okay, you
Bye.
too.
Thank you,
Thank
Melissa.
you. Thanks, Melissa.
Okay.
Bye-bye.
Bye.
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 Blessings and love, everyone. Good night.
Thank you.
Bye-bye. Good night.
Khalid, I had a question. I think it's Khalid that's coming up at CB9. Were you able to capture the stuff from the chat? Okay.